that this has been recorded. Okay, so again, my name is Carissa. Because this is now recorded, I need to introduce myself. So my name is Carissa. I'm the Education Manager of Nursing Education and Training Australia, and today we will be discussing about the National Inpatient Medication Chart. So just a little bit about ourselves, and it is very brief. So we are the pioneering preparatory course provider for both NCLEX and OSCE, and the NCLEX is the multiple choice question, or the MCQ, which is a theoretical component of your outcome-based assessment, and the OSCE, or the objective structured clinical examination, is a practical component. So for all registered nurses overseas who wants to come in Australia to be a registered nurse, you will now be undergoing NCLEX and OSCE after being assessed by APRA during your portfolio stage that you are eligible to do so. So we work across the country. So we do have offices in Sydney and Melbourne, and we do provide our OSCE training as well in Queensland, specifically in Brisbane or Sunshine Coast, and also in Adelaide. We also work overseas because we do have a lot of students who are actually from overseas. So mostly from Philippines, Nepal, India, and those other countries that are also working not in their home country but also outside of their country, such as UAE, Dubai, Singapore, Malaysia, few students from America and there's something else, Qatar as well. So we do have clients across the globe. And as I said, we do have simulation labs across the country. So these are our offices in both Sydney and Melbourne. And it says here that our vision is that NETA is a preferred education provider for all internationally qualified nurses who want to take the outcome-based assessment. And our mission is 100% passing percentage of all OBA takers from any TA. You need to also know that the mission is something that we want to accomplish, and there is always room for improvement. So we are not there yet. And with a lot of external factors, there are a lot of students that actually do not make it for the first time for their exams. And this is where we come in, because we really want to support students and tick off your goals to become registered nurses. So this is also an education that you have to be very careful as well with the marketing of 100% passing percentage, because it is impossible to do so, especially in Australia, that this is a very new process. So NCSBN has 93% passing percentage at the moment, and NCSBN is actually the test provider of NCLEX, and that is your passing percentage. So we have to look into what is real when it comes to the market. So that is our mission, and we are aiming for 100% passing percentage. These are our values, and everybody in NETA, staff and students, practice these values, and you will have more of this information when you actually join, and how we are expecting you to practice these values. So knowledge, support, respect, teamwork, and transparency. So I think everybody already has, you probably would already have a research about NCLEX. So this is National Council Licensure Examination, and this is provided by NCSBN, and the test is done through Pearson VUE. So it is delivered according to the test plan, and if you join with us, the test plan will be detailed to you, so that you will be able to know what actually would come out in the test. It's more of what are the topics that will come out in the test. We do not know the exact questions that will come out in the test. So again, this is an education for you, that all test or all preparatory course providers do not know what will come out in the test. So NCLEX is a very measured test, and we wouldn't know what will come out. But we know the topics that will come out, and what we will be teaching you would be the strategies as to how to address those questions in NCLEX. And it is a computer adaptive test, so it adapts according to your capability. More information of this is in our videos in YouTube about NCLEX, so you can have a look at that. And then for OSCE, this is an objective structured clinical examination delivered in Adelaide at this stage, and it is a practical component that will check your cognitive, your affect, which is your behavior, specifically your communication skills, and also your psychomotor skills, which is actually you performing that skill. So the National Inpatient Medication Chart that we will be discussing today is NCLEX and OSCE. So it will benefit both who are taking NCLEX and OSCE. It is also stated in the OSCE where this actually would come in. So I'm not sure, Sushila, are you looking into NCLEX or OSCE preparation?
For the OSCE preparation.
You're looking for OSCE.
Yes.
There is this JRR. I really don't want to call you JRR, but are you looking for NCLEX or OSCE? And you're on mute, JRR, if you're trying to talk, or you can give us a message. Okay, OSCE, perfect. So for Shilea, who's here today looking for NCLEX in the beginning, but Shilea, by all means, get prepared as well for OSCE, because you will reach at this point also. So for NCLEX, part of your test plan is medication, which is your pharmacology, and also your parenteral therapy, which is your IV medications. And this is where you will be using the inpatient medication chart as well for the documentation. For OSCE, it is also stated in the handbook where there's calculating drug dosages, intramuscular injections, and your medication administration. Of course, it would also incorporate and integrate your therapeutic patient communication. Hand hygiene is always there anyway, so as infection control practices. It will also incorporate patient identification and also your intravenous therapy and risk management. So when you provide your IV medication, you also have the incorporation of your aseptic non-touch technique. So you can see here that medication administration itself would cover a lot of the skills that APRA or the NMBA will be assessing you on. So this is one of the major topics that we will be discussing in your OSCE class and also in your NCLEX class, because medication administration does not only deal with risk management, but also for patient safety. One medication error may cost a life of a patient, and that is the reason why NCLEX and OSCE has specified medication administration and documentation as essential component of the test. So the following has been provided as well by APRA as reading materials. If you enroll with us, all books that are indicated here in the APRA handbook is with us in our main offices, and you can borrow them as well. So this one is online, the Australian Commission on Safety and Quality in Healthcare. It's a massive website because it contains all the standards that is expected of you as a registered nurse. If you look at our YouTube videos on the National Safety and Quality Health Services standards for all healthcare practitioners, you can see how extensive it is. We do have 8 standards that we follow that all healthcare practitioners must perform. And this is where APRA is going to test you on whether or not you are ready to become a safe registered nurse following all those 8 standards. Number 2 is your Australian Medicines Handbook, and this is a hard copy, and we do have this in both of our Sydney and Melbourne offices. And this is, I think, $260 per book. So we don't really want you to spend that much that much amount for a book. So you can also have a look at that book in our office. Then we have Jarvis Physical Examination Health Assessment. This book probably would cost about $130. This is also available in um, our offices and simulation lab. And the Fundamentals of Nursing, Clinical Psychomotor Skills by Tollefson, and um, and also the I was thinking of other books, but we actually have 4 other books that's not listed here that is very essential as well for you as registered nurses in Australia, and very essential for your OSCE preparation also. So all of these books are available in our library. However, because we don't want you to carry this pile of books, we have integrated all of the contents of these books into your learner's portal as well. So if you are not a read and write person, that's fine. You can visualize this, and we have incorporated this through all of our lessons. Um, Definitely, the Australian Resource Council it's a website, so as ISBAR therapeutic guidelines and the standards of practice, and all of these resources are integrated in your OSCE classes. So today we will be talking about the NIMC, or the National Inpatient Medication Chart, which is part of the many components of medication safety. So if you look at the video on the national standards, which is found in YouTube, you can see there that standard 4 is all about medication safety. So we talk about medication safety with quality use of medicines, high risk medications, which is your A-pinch S, medication chart, which we'll be talking about today, medication reconciliation, safe naming, labeling, and packaging of medicines, which includes the National Tollman lettering, user applied labeling of injectable medications. Then there's medication administration that includes your scope, abbreviation, calculation, and the rights, and the schedules of medicines. So you can see here that it is very vast and complex, and we're only discussing a single aspect, which is the medication chart. And with a medication chart, this is something as well that is not common for overseas nurses, because this is something that we use nationally in Australia, and that's why it's called the National Inpatient Medication Chart. This is actually what we use in the whole Australia. So, and today is a demo class, which means that we cannot provide all of the information because the medication chart itself is very vast and complex, and we cannot fit this in an hour session. So I will touch on the very important parts, but what this means is that when you actually go to your OSCE, you need to know every bits and pieces of the medication chart, because this is expected of you as a registered nurse. You need to know medication administration as part of the skills that we talked about that you need to be assessed on during your test. All right, so let's talk about the why it is very important for nurses to be able to know what is the medication chart in Australia, and why do you need to know the Australian National Inpatient Medication Chart? And it could be a question and anyone can just answer, and this is a safe space, um, and probably just 1 or 2 reasons from the audience. Why do you think we need to know the Australian medication chart? And that could be from Shilea, Sushila. Yay, you already changed your name. You're Joanne. Joanne, if you don't want to talk, because I know that you've been typing, you can also type your answer there. So, Shilea, do you have any? idea why do you need to know about medication safety, medication charts? So Asushila, you're on mute, by the way, if you're trying to talk. Maybe we'll start with Shilea. Shilea, you've put yourself off mute, so I know you wanted to share your thoughts. Do you want to share your thoughts about the why?
It's different from the we are from the different country. It's here is a different country have their own rules and regulation according to provide the medication, and for the record, so it's a format is a different, so that we have to learn how it is the system is here. So for them, and but for omitting the wrong providing wrong medication.
Perfect. That is a very good, very valuable information that you shared. You're talking about the systems, and that is the reason why there's NCLEX and OSCE, because we really want overseas nurses, when they come and practice in Australia, they actually know the system, and that is very good. We know that all of us here know what is paracetamol. Everybody knows paracetamol. Let's change it to metoprolol. Everybody of us here knows what is metoprolol. And yeah, that's right. The administration of metoprolol, the book also would tell us, and that is a standardized approach. But how are you going to document that, and how does it look like in a medication chart is quite different from where you practice back home and where you will be practicing in the future here in Australia. So that's very good. Shilea also mentioned about what we need to omit or what we need to unlearn, and that is exactly right. We need to unlearn the things that we knew back in our home country where we were trained, because we need to learn this new system, because this is where we are seeking registration to work in Australia. So thanks for that, Shilea. That is a very valuable answer. And of course, you also mentioned about medication safety, which is an essential component of medication administration, which is, if you have watched the video about the national, the RN standards of practice, your standard of practice 7 is actually your evaluation that includes your documentation. So documentation is essential, and you will be documenting that in your medication chart. So let's have a quick look on how does this medication chart look like. Does anyone or any one of you have seen an Australian medication chart? Joanne, have you seen this before? I'm just taking the, taking the time. Maybe Joanne is typing her response. Shilea, have you seen the medication chart before?
No, I have not seen.
You haven't seen? Kay Kong, have you seen the medication chart before? If you're trying to talk, you're off mute, by the way. You're on mute, by the way. No, not yet. Okay. So I'll quickly show you what it looks like. Joanne, yes, ma'am, from my friend who studied preaching course, but not in-depth details. Perfect. So, so this is how a medication chart looks like in Australia. How do you feel about that? Looking into it. That's the first page, by the this is the first page, by the way. This section here is the first page. This section is the last page. And if you go inside, this is the second page, and that is the third page. How do you think, just by looking at it, what do you think? Complicated, complex, easy to understand, seen it before? What do you think, Shilea?
It has included all the important recorded things, and there is no missing if we complete this form.
Mm-hmm.
This is seeing complicated too.
It looks complicated, isn't it?
Yeah.
Yeah. Complex. There's a chat there. It's complex and it's very detailed. And yes, that is correct. It's very complex, very detailed. And looking at it in one glance, you probably would say, no, I'm not going to practice in Australia anymore. I'm not going to study anymore. It's just so complex. Joanne, what do you think about it? You can type a chat. Oh, sorry, Sheila, you were saying something?
Oh. No, it's okay.
Yeah, you can say. While waiting for Joanne to type her answer.
It will help to, it will include all the things here and well documented if we complete this, all the things.
Yes, very well documented because everything is just here. And that is quite right. The thing here is this medication chart is composed of so many aspects, and discussing this in details, hopefully I can do a very quick, brief of what each of these components looks like. But if you can see here, just the first page itself, it's also very self-explanatory. The thing is, you need to know when to use which part. And also you need to know the um, very small aspects, because they are actually very important. So um, I will open up another presentation where we actually um, do this in our classes, and because we couldn't cover all of it, I'll quickly run through with it. So that is the front page of the medication chart, and you can see that. So I'll just probably draw. So you can see, oops, sorry, just do an annotation because this is not a PowerPoint presentation. Okay, so you probably see here, medication chart, blank of blank. So again, this is the page number. It doesn't sound important, isn't it? Oh, it's just a page number. That is not really important. But why is this very important is because in Australia, we do have patients who we call as a polypharmacy. Patient who's polypharmacy. What does it mean is this patient has more than 10 medications taken for the day. I did have a patient who's actually had 21 medications, and the medication chart went up to page 5. So you can see that there are 5 medication charts, and if you miss one because number one, the pharmacist probably would have took it, number two, the manager took it for a medication error, inquiry, for example, so you'll miss one chart. And what does it mean if you miss one chart? You actually miss the medication. How many medications are there in one chart? You don't know, probably 10 medications. And what will that mean? If your patient, say for example, is taking a medication for atrial fibrillation, and that medication chart is not there, and you did not recognize that you miss one of the medication chart, you've given 1 of 5, 3 of 5, 4 of 5, 5 of 5, but you haven't given 2 of 5, and your medication for atrial fibrillation is there. In the afternoon, your patient suddenly goes to AF. What does that mean? It is unsafe for your patient, isn't it? So looking into just one aspect of a medication chart actually would give a lot of impact. And in cases where it is a life-threatening condition, that is your registration at risk. And that is the reason why you are having this preparation, because we want you to be prepared as well to become a registered nurse, and you won't miss it because your registration will be at risk. So that's just one component of the medication chart. The rest of the components I will be discussing as we go through each presentation. Do you have any questions at the moment?
No.
Shilea, have you seen the importance of just one component of this medication chart?
Yeah.
Good. Joanne, I know that you have seen this medication chart and not in depth, and I am aiming to actually cover all of the components of this, and fewer examples will be discussed online during the OSCE online classes. Okay, so let's go to the next page. So you can see here, this component here would be your ADR, or adverse drug reaction sticker. So this is where you can actually see your allergies, for example. So if your patient is allergic to something, and what does this mean is if you miss out this part of the chart, your ADR, you may be giving a medication that your patient has very has a reaction to, whether adverse or mild. So um, in this case, say for example, you have your penicillin, which is the adverse drug reaction of your patient. If you give any medication that is penicillin based and you miss this part of the chart, then it could be a life-threatening condition again. We talked about patient identification as part of your of the skills that APRA will be assessing you, and that is actually standard 6, and you can see how it is integrated in your standard 4, because you need to make sure that you have the right patient when you do your medication administration. And how is that indicated in your medication chart is your patient's identity. So that's where you see your patient's identification as to how you will be asking your patient. That is part of your therapeutic communication. There is a way that we will teach you how to identify your patients according to standard 6, because standard 6 is also a vast, complex topic on its own, and it takes a lot of communication. We do have nurses who actually said that I thought I knew how to ask a patient's details. However, during our simulation, it was quite hard to actually ask. So how do you ask a patient where your assessor becomes really confident in 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 your skill? That is something that we also teach you, but this is where patient's identity comes in. Then you have your once only medication. So your once only medication are your medication that you give as an on-call medication or as a stat medication. So you can see that in your first page, you do have once only and nurse initiated medication. Shilea, just a question, and Joanne and Kay, if you are practicing overseas, are you able to administer nitroglycerin on your own without a prescription? Nitroglycerin, or they normally come as a spray or sublingual or as a patch, GTN patches.
Sublingual tablet.
Yep, sublingual. They also come through as a sublingual medication.
Yeah.
Are you able to prescribe this? Not administer, but prescribe in
No,
your home country? Or
no,
do you
we
need a
are.
doctor?
Yeah, we need a doctor.
In Australia, we do have a protocol that we can nurse initiate nitroglycerin. Paracetamol, for example, is a nurse initiated medication. Medications for constipation, these are nurse initiated medications. So there are certain medications, and this is again another broad topic that we will be discussing in your OSCE class, because there are certain medications that can be nurse initiated as a registered nurse in Australia. And this is where you are going to chart them in this section. So your nurse-initiated medications, your once-only medications, say for example, the furosemide that you administer after a blood transfusion, that can be ordered there. On-call medications, so medications that you administer um, prior to transporting the patient to theater, for example, are here in once only medication. Stat doses are also here in once only medications. So you can see that this is that part of the medication chart. Then you go to telephone orders. In Australia, I'm not sure in your home country, in the Philippines where I am trained, and I said to Shilea that I'm married to a Nepalese, so I have both countries in my role. But in Philippines, when I was trained, is that with telephone orders, there is no specific protocol whether it's valid or not. Um, Once we get a telephone order, we then look for this doctor, whoever this doctor, and if this is not signed, what we normally do is we don't go home until the doctor signs for it. So, um, is that the same in Nepal, Shilea, and Joanne? I'm not sure where you are practicing at the moment. How is it in your practice? So as K, Sushila, I think Sushila has logged out. How is it in your practice with telephone orders? Are you allowed to do this? And what is your practice? Do you chase the doctors to actually sign
Yeah,
these medications?
we call it the verbal order. We
Mhm,
have the register of is the same like here in the telephone order chart.
mhm.
Yeah. We also have to chase the doctor to sign here. Please, doctor, sign here.
Yeah.
It have to sign within 24 hours.
Mhm.
Yeah, we also used to do like that.
Good. And it is good to know that that's the practice in Nepal. In Australia, yes, it probably is the same that we do telephone orders. It has to be signed within 24 hours. But we know that doctors have their own accountability for also giving out the telephone orders. So we do remind them, but in Australia, we never chase them. The reason is once you receive a telephone order, you've got the initials of nurse 1 and nurse 2, you've put the prescriber's name. Doctors themselves are very responsible in signing their telephone order because they also have a registration that they have to protect. Back home, when I say home, is Philippines, where I was trained, I have to chase these doctors because sometimes these doctors do not sign the order, and then I become so scared that my registration will be at stake. It's the same in Australia. However, we don't really have to chase them because they also have their own accountability. And same as doctors in the Philippines have their accountability, but there is that superiority as well. I'm the doctor, the nurses have to chase me. In Australia, we're all equal by profession, we're all independent, and we can't work together if we don't help each other. So that's how we call the interprofessional relationship between nurses, doctors, and the rest of the healthcare team. So in this case, we do have telephone orders. Two nurses have to listen to the order. The doctor will sign. They must sign, but they will sign because they hold accountability for it. So we don't chase them anymore. There are very few instances where we have to chase them, and that is after 24 hours when you see that it's not signed but the doctor's name is in there. It's more of paging them or telling them that hey, you forgot to sign your medication order and telephone order. um, so that is the practice here. And as to the scope, as to who can take medication orders, how many times this has to be repeated, we do have another demo class in our YouTube video on telephone orders. That is also another vast session. So if you'd like to listen to that, visit the YouTube videos that we have because we do have a demo class on telephone order. So again, it is a demo class, and so not all of the information has been covered there, but there are really good nuggets of gold that you can take away from there. The medicines taken prior to presentation to hospital. So if we go back to our presentation, we said about medication reconciliation. So this part here actually is implemented in your medication chart, which is this part here, the medicines taken prior to the presentation to the hospital. Um, in my practice as a registered nurse back in the Philippines, we do have patients admitted in the ward with chronic complex medical conditions. This means that they have, say, hypertension, diabetes, kidney failure, and all other sorts of other diseases. They're on warfarin, blood thinners, for example. They come to the hospital for a surgery, and when they come to the hospital for a surgery, after the surgery, the doctor will prescribe them medications related to the surgical procedure, such as antibiotics and pain relief. Where are the other medications that the patient has taken prior to coming to the hospital? Warfarin, for example, which is an anticoagulant, is very important for nurses to consider prior to surgery. Do we know whether or not this patient is on warfarin? Do we know whether or not the patient is on other medications? So there has been a lot of incidences in the where I used to practice where we only give antibiotics and pain relief for this patient who's coming for surgery, and then later on they have stroke or heart attack because they're bleeding, or they haven't had their AF medications, they haven't had their antihypertensive medications. Patients who are on seizure tablets, for example, on maintenance, and we couldn't give them because um, it's not charted in the current medication chart. So this is the reason why we have medicines taken prior to presentation to the hospital, so that we are aware what are the medications the patient has to take on top of the medicine that the doctor has prescribed because of that admission. So this is part of the medication reconciliation. Again, this is a very vast topic, and we haven't done a demo class of this as of yet. Um, Keep posted. We will be doing some demo classes for this also to help you with your OSCE preparation. So that is one part of your medication chart. So let's move on to the other parts of your medication chart. Any thoughts while I quickly erase these annotations? Thoughts, learning, um, anything that you'd like to share from your previous practice? Okay, Joanne, Shalea. Okay. Um, let's proceed to the next part, which is your um, variable dose medicines. So there are medications that varies in um, dosage. So Shalea taking NCLEX, you probably would have some ideas. Now, what are these medications that can be variable? Any thoughts? Anything that you can recall from your practice where you change the dose from day one, day two will be a different dose, day three will be a different dose? And if you can't recall anything, that's also fine.
Prednisolone.
Prednisone, very good. So prednisone on a tapering dose, or if the patient is on a tapered dose, because we are going to wean that patient with prednisone, this is where it is charted. That is a very good example. Another example would be doses that would need levels taken, drug levels such as vancomycin, gentamicin, digoxin, will be charted in this area. As to the documentation, um, it is quite complex, but this one white vertical line would be one day and the other gray line would be another day. And you will have a lot of exercises doing documentation during your online class. We do virtual simulation in your online classes where we put the medication name here and then you will be signing after you actually administer the medication. So it will be a practice on communication, how you're going to administer the medication, and the whole process of medication administration, and then we will let you document in the chart. We do have VTE medication chart as well, and this could be your heparin, your clexane, your fragmin, and then we do have your warfarin as well, which could be your Marivan or your Coumadin. And then we do have your regular medications here, and this is where the medications that the patient normally or regularly takes is charted. So say for example, vitamin D. If your patient normally takes vitamin D, if your patient normally takes calcium, if your patient normally takes say sodium bicarbonate, if your patient normally takes paracetamol, Nurofen, this is where it's all charted. You can also see that the 5 rights of medication administration is integrated here, and this is how you would consider a valid medication chart. And again, this is another vast topic that we allot 2 to 3 hours just to um, talk about one particular um, one particular component of the medication chart. So you can see here that the 5 rights of medication administration is actually implemented together with your patient's identification on this part here as well. So you can see there that there's a date, the route, the dose, indication, pharmacy notes, who's the prescriber, what's the contact, the name of the medicine, and if it is a slow release or not. So all regular medications, including new medications that are charted for the reason of the admission, would be charted in this part. And then moving forward to the next page would be your PRN medications. And your PRN medications are medications that you give as needed. So we learned this from university, and how do you document that is another session. But these medications are charted at the back of your medication chart. So you can see here that there's a dose, hourly frequency, and you might ask, why is there an hourly frequency for a PRN medication? I thought that it is a medication when needed. But you also have to realize that there should be interval of giving medication. So say for example, paracetamol is a PRN medication. If the patient is in pain, if you don't write here every 6 hours as needed, then you can give paracetamol every 2 hours, which would be life threatening for your patient and which could damage the liver of your patient. So each of these component again will be discussed in your OSCE online classes. So this is the whole component of the medication chart. But if you can see as well, in the middle of your medication chart, you do have the recommended administration times. And you can see here that it is a recommendation. And in your OSCE, what will happen is there might be some variances because your OSCE will actually check your critical thinking and will check whether or not you're able to critically think or use your clinical judgment, whether you use those times. So these are recommended administration times in your real in your OSCE class. We will be teaching you all the what ifs and when to actually create some variances of the times. So it depends on the patient scenario. What scenarios can you change the timing of this medication? So that will be discussed in your OSCE. You also have this sustained released. So these are your tick if slow released, and you do have medications that are actually slow released medications, and these are medications that could be enteric coated or medications that are designed that would be dissolved in the intestine and not in the gastric area. So this is something that an information that I'm giving away straight on because they're we wouldn't be discussing about taking it off, but we will be discussing in your online classes what are these commonly charted used medications that are slow released. And then we do have an anticoagulant education record. So all patients who have this part, which is your VTE or your warfarin, will have an anticoagulant education record. And this is another part or another component of your OSCE as to how we do provide education and how does this booklet would look like, or the written information would look like. And then you have the reasons for not administering the medications. And it could be of various reasons, whether the patient is absent, fasting, refuse, vomiting, on leave, not available, and if this is withheld, or if the patient has administered it by himself or herself or on its own. So you can see here the abbreviations that we use as to how you document this, when do you document this, and what do you do if you document this. These will be discussed in detail during your online classes. So if a patient is absent, you can write absent there, but that's not the end of the story, because if the patient is absent, but this medication is an anti-seizure medication, you cannot just say, I haven't given the anti-seizure medication because the patient is absent, and later on your patient comes back to the ward and then your patient will have seizure. What do you do? Seizure, again, is a life-threatening condition because it entails some airway management, which is number one in your ABC. So again, if you have written absent, what are your nursing responsibilities, and what do you do after documenting this A in your medication chart? So in that case, we will be discussing that in your OSCE and in your NCLEX online classes, because these are, again, safety measures. And as registered nurses in Australia, you're expected that you already would know how to manage these circumstances. So I think that is a brief overview of the medication chart, and also very brief overview as well as to the components of the medication chart. We haven't really discussed some nursing responsibilities, which is very essential for you to be able to pass your test, both NCLEX and OSCE, and this will be discussed in the classes. Any thoughts, ideas, comments, questions from the group while I'm slowly erasing all of this in my annotation? And Joanne, you can type your questions as always if you want to, because I know that you're looking into the preparation of OSCE, and I know that it can be very overwhelming just with one skill and one component of your OSCE preparation. So again, we were talking about these concepts for Standard 4. We have 8 standards, and today we are discussing the medication chart alone, and we haven't discussed all of it in this session. So I know it could be very overwhelming, and we are here, and that's the reason why we're here, to provide you the information. Our educators are actually expert in the field, and we're doing this every day for over how many years now. So that is something that we can guide you through. So keep posted, follow our Facebook page for you to be able to know when will be our next demo classes. Or you can go to our YouTube page as well, so you can see the demo classes that we have there. So for our NCLEX, I did share that to Shalea, who is looking into the NCLEX preparation as to how long, what are the components of the NCLEX. And for our OSCE, where Joanne is looking into, and Sushila, and for the rest of the group who will be listening to this recording. So our OSCE is a 2 weeks of online class and 1 week of face-to-face, and we do have 4 components of the OSCE. So we have a learner's portal where you can see all of the necessary skills that you are required to perform at a level of an entry graduate registered nurses, all the theories, all the expected steps for you to be able to perform the skill will be in your learners portal. There will be a lot of activities in your learners portal as well, and also some quizzes. We do have the handbook also. We call it a workbook because it's got a lot of activities as well. And your workbook will also have some activities where you are actually performing the skill yourself. We do value your knowledge and your skills, and we do value that you are already registered nurse back in your country. So it wouldn't be the first time that you'll be performing few skills. However, we will be guiding you as to how you'll be performing these skills in an Australian standard, and that is also indicated in your learners portal and also in your workbook. Another component is your 2 weeks of online class, and the last one is your 5 full days of face-to-face. As an additional or add-on, all of our assessment tools are designed according to the assessment of an Australian registered nurse. How are you going to be assessed step by step? So if you have looked into our demo class about the standards, we have also indicated there how the assessment tools are actually designed to intertwine all the standards, the national standards and the NMBA standards of practice, plus your professional standards that includes your code of conduct and your ethics as well. So it is very complex. It sounds so complex, but it is very easily presented in the assessment tool. So you don't have to worry about knowing what are expected of you because they're all in your assessment tool. You will have, aside from the standardized tools, you'll be introduced to Australian system or Australian pathways of managing certain conditions, such as sepsis, for example. So we tell you the sepsis pathway. Chest pain, for example, there is a chest pain pathway. Blood transfusion reaction, there is also a pathway. So we share this to you. I know that back in our country, we do have different systems. In Australia, it's also a different system. So we will teach that. We will teach this during your OSCE, online and face-to-face. And then we have your resources. So again, if we go back to the resources, this is the resources listed by the NMBA or APRA in your handbook, and we all have this incorporated in your program. However, if you really want a physical copy of the books, we also we have them as well available in our simulation labs. So it's there. Feel free to also use it. And Shilea, by the way, for your NCLEX as well, all NCLEX resources that we have are integrated in your portal. However, if you want a physical copy of the books that we recommend you to study also, we also have this in the office that you can use.
I can.
Then we have your hospital chart. So this is something that you need to learn, unlearn from your home country, relearn or new learning from your new country, which will be Australia in the future. So we will be introducing you to hospital charts. We have designed them in NETA that is very similar to what is being used in the hospital. And of course, we have these sessions, which is online and face-to-face. All of these resources are accessible within the next 6 months. It is for 3,500. Number one is 3,500, but you're able to access them in the next 6 months. You're able to attend your face-to-face sessions as well. You're allowed to attend up to 3 face-to-face. So if most of our students are confident with one, they polish again with a second one. But if you really want to have another one, and that is completely fine as well. All of our offshore students will have continuous online access. The 6 months of access will start once the border will open. So again, we don't want you to settle for less. All of our nurse educators are very well experienced in the field of nursing. We do have qualifications and also experience of new grad nurses. And this is what APRA is really targeting, new graduate skills. And I myself have been a new graduate educator for years. And this is my bread and butter. This is what I do every day. And for most of our educators are also doing with OSCE, have been preceptors and educators of new graduate nurses. So our goal here is for you to pass your OSCE. So if you're looking into OSCE, if you're looking to NCLEX, our goal is for you to pass your NCLEX. And what you need here is the advice and the guidance of those who have been there already, which is us. So for more information, we have our contact details in there. So you can visit our office if you're in Sydney or in Melbourne. You can also send us an email, info@nursingeta.com, and also our contact phone number is also there, and also our website. So I think that's it. Is there any clarification that you have, or any questions? You can type it in, or you can just tell me, or you can just ask. Shalea, do you have any questions?
Yeah. Can I study that from the learners portal now?
The Learners Portal is accessible once you enroll with us. So if you would like to start practicing your questions, we encourage you to send us an email, or if you haven't followed us yet in Facebook, go to the Facebook page and search for NETA OBA. Add us as a friend there, and you can send instant messaging there as well for you to be able to gain the access. So you need to enroll in the course for you to be able to practice these questions and for you to be able to go through all of the resources.
Okay. I'm on the Facebook also. I like the Facebook.
Sorry, I'll just stop